Hi guys, good morning. So today's video I will be doing head to toe assessment. So for today, I am your nurse today. I am Monica Suwan and I am doing a head to toe assessment. Is that okay with you?
Yes.
So next to that is that we will perform a hand hygiene, and next is we will gather the information of the client. So what's your first name and last name?
Justin Casas.
What's your birthday?
February 11, 2007.
What we are doing today?
Head to toe assessment.
Okay, she answered that with an ease. After providing privacy to the client, perform hand hygiene and introduce the self to the client, we need to collect their vital signs. First is the pulse rate. Next is the temperature. Third is the blood pressure. And note that before even assessing a body system, you are already collecting important information about the patient. And lastly, the respiratory rate. Then start with the hair. Inspect the overall appearance of the face. Is the face symmetrical? Close your eyes. Open your mouth. This is to test the cranial nerve 7, which is the facial nerve. Palpate the cranium and inspect the hair for infestations, hair loss, skin breakdown, or abnormalities. Inspect the hair for any infestations like lice and alopecia. After that is perform hand hygiene. Palpate the temporal artery bilaterally. This is to test the cranial nerve 5, which is the trigeminal nerve. This nerve serves as the responsible for many functions, and mastification is one of them. Palpate the temporomandibular joint for grating or clicking. Palpate the frontal and maxillary sinuses for tenderness. Patient will pressure but should not feel pain. Next is the eyes. Inspect the eyes, eyelids, pupils, sclera, and conjunctiva. There's swelling of the eyelids. Is the sclera white and shiny, not yellow as on jaundice? To test the cranial nerves 3, 4, and 5, have the patient follow the penlight by moving it 12 to 14 inches from the patient's face in the 6 cardinal fields of gaze. Dim the lights and have the patient look at a distant object. This dilates the pupils. Shine the light in from the side in each eye. Make the lights normal and have patient look at a distant object to dilate pupils, and then have patient to stare at the pen light and slowly move it to closer to the patient's nose. Next is the ears. Inspect the ears for drainage or abnormalities. Ask the patient if they are experiencing any tenderness and palpate the pinna and targus. We use the Rayleigh test and the Weber's test for the hearing. Test the cranial number 8. Test the hearing by occluding the one ear and whispering 2 words and have the patient repeat them back. Cover your nose one side and breathe. Other side. Use a pen light to shine inside the nose and look for any lesions, redness, or polyps. This is to test the cranial nerve 1. Next is the mouth. Inspect the lips. To test the cranial nerve number 12, have patients take tongue out and move it side by side. Inspect the inside of the mouth. Gums should be pink and shiny. To test cranial nerve number 9, have the patient say ah. The alveoli will move up, and if the patient can swallow with ease and has no hoarseness when talking, cranial nerve number 10 is intact. Next is the neck. To test the cranial nerve number 11, have the patient move head from side to side and up to down, and shrug shoulders against resistance. Inspect for jugular vein distension. Palpate the lymph nodes with the pads of fingers and feel for lumps, hard nodules, or tenderness. Palpate the trachea. Palpate the thyroid gland from back. Note for nodules, tenderness, or enlargement. Normally can palpate it. Palpate the carotid artery. And then auscultate for bruits at the carotid artery. Listen for a swooshing sound, which is a bruit. Have a patient breathe in and out and hold it while listening. Next is the upper extremities. Palpate the radial artery bilaterally and grade it. And then palpate skin temperature. Palpate joints, elbows, wrists, and hands for redness and move the joints. And inspect the hands. Hands and fingernails for color, they should be pink. And have the patient squeeze your fingers. Note the grip. And assess for arm drift by having the patient close their eyes and extend both arms for 10 seconds. Then next is the chest. Locate first the apex of the lung, which is right above the clavicle. In auscultating, start at the apex of the lung, which is right above the clavicle, both sides. Then move to the second intercostal space to assess the right and left upper lobes. and then move to the fourth intercostal space, you will be assessing the right middle lobe and the left upper lobe. Lastly, move to the mid-axillary area at the sixth intercostal space, and you will be assessing the right and the left lower lobes. To auscultate posteriorly, start right above the scapulae to listen to the apex of the lungs. Then find the C7, which is the vertebral prominence, and go to T3 in between the shoulder blades and spine. This will assess the right and left upper lobes. Then T3 to T10, you will be able to assess the right and left lower lobes. Next is the abdomen. Have patient lay supine, ask patient about their last bowel movement and if they have any problems with urination. Inspect the stomach. Check for any masses. Auscultate with the diaphragm for bowel sounds. Start in the right lower quadrant and go clockwise in all the 4 quadrants. Auscultate for broods. Light palpation should feel soft with no pain or rigidity. Deep palpation, feel for any masses, lumps, and tenderness. Lastly is the lower extremities. Palpate the pulses bilaterally. Popliteal behind the knee. Palpate the muscle strength. Have patient push against resistance with feet and left legs. Palpate the dorsalis pedis, which is the top of the foot. The posterior tibial at the ankle and grade them. Test the Babinski reflex. Curling toes is a negative normal response.